My name is Angela Walls. I'm a student at Indiana Wesleyan University. Today I'm doing an assessment on the congestive heart failure patient.
I understand that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan University students. I give my permission for this information gathering and physical assessment to be filmed and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be for access by faculty and students at the Indiana Wesleyan University. It will be deleted by the student as soon as it is reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University faculty and staff, as well as the student, are not considered liable.
Hello, Ms. Corbett. My name is Angela. I'm going to be your nurse today.
Hi.
Can you give me your full name, date of birth, and today's date?
Andrea Corbett, 4/14/73, September 21st.
What brings you to the hospital today?
I'm just really short of breath.
How long has this been going on?
About a week.
Is it getting worse as time goes on?
Yes.
Okay. Do you have a cough with this shortness of breath?
A little bit.
Are you bringing anything up with it?
No, not really.
No? Okay. I'm going to obtain your vital signs real quick. Just slide this under your tongue. Okay. Temperature is 98.3. Do you have any allergies?
Penicillin.
What's your previous medical history?
Hypertension and cardiomyopathy.
With the cardiomyopathy, do you know what your ejection fraction is?
No.
Okay. Have you ever smoked?
No.
Do you drink alcohol?
No.
And do you use any illicit drugs?
No.
What is your current height?
5'2".
And how much do you weigh, typically?
Typically 120.
Okay. According to the bed scale, you weigh 140 pounds right now. So you have a 20-pound weight gain. We'll try and figure out what's going on with that.
Okay.
Do you walk a lot at home?
I can't right now too much.
Okay. Do you use anything to help you get around at home, or are you pretty much independent?
Pretty much independent.
Are there any government agencies or any home health agencies that come in and check on you?
No.
Okay. If you don't mind, I'm going to start to do an assessment.
Okay.
First, I'm going to have you squeeze my hands. Can you touch your nose with your eyes closed? Smile for me and raise your eyebrows. Okay. All right. So both sides are equally on both sides, so that's good. What I'm assessing for is like signs or symptoms of a stroke. I noticed your legs are very edematous. Is this new for you?
It's new in about the past month.
Okay.
It's getting worse.
So I can see that there's probably at least +2, if not +3, pitting edema from your knees down to your feet. Can you push on my hands and raise your toes up to your head? Okay. Are you able to lift your legs one at a time at all? Okay. I can see that you're very weak due to the edema. Okay. Next, I'm going to feel for your pulses. These are your radial pulses. They're +2 on each side, which is good. Your lower extremities, because of the edema, I can barely feel your pulses. They are present. I'm feeling on the top here for the dorsalis pedis pulse, otherwise known as DP pulse. And in the back behind the ankle, the posterior tibial pulse, otherwise known as the PT. Both pulses are +1 bilateral, but they are present. Next, I'm going to squeeze your toes and look for capillary refill. I'm looking to see that the pink turns back to white in less than 3 seconds, which it does on both your toes, which is good. And then I'll look at your nail beds as well. And yes, both your bilateral feet and bilateral hands have less than 3-second cap refill. How about your abdomen? Do you have any tenderness, or I'm just going to press? Any tenderness anywhere I'm pressing? No? Okay. So I will note that there's no tenderness in the right upper quadrant, so it's negative for hepatomegaly, and I'm going to listen for bowel sounds. Which I hear bowel sounds in all 4 quadrants. Are you having regular bowel movements? Okay, good. And I noticed that your skin is clean, dry, and intact. Do you have any skin issues other than the lower extremity edema? No, and there is a peripheral IV, a number 20, located in the right forearm. So next I'm going to focus on your respiratory status because that seems to be the main problem of why you're here. So when I'm looking at her, I can see that her chest rises and falls symmetrically on both sides. Her chest is round, it's not barrel chest or sunken, which is good. I'm just going to palpate up here to make sure that your midline, your trachea is midline, which it is, midline on both sides. And I'm just going to look at her chest to make sure she's not using the intercostal spaces or accessory muscles in order to breathe. Which her breathing is a little tachypnic, meaning it's fast, but I can see that she's not using accessory muscles in order to try and catch her breath. So next, and I also notice her mucous membranes are pink, but they are dry. So she may not be taking in enough fluid right now, or it might be due to the oxygen in your nose. So I'm going to just kind of palpate your chest just to make sure there's no trauma and I don't feel any crepitus. Next, I'm going to sit your bed forward so I can look at your back. And what I'm noticing here is there's no spinal abnormalities, no kyphosis, no scoliosis, and I'm going to palpate again just to make sure I don't feel any trauma or any crepitus, which it is negative. Next, I'm going to have her say 99, and I'm going to feel for vibration to see if I can feel vibration when she says it. Can you say 99 for me?
99, 99, 99.
Okay, I don't feel any vibration with that. So next I'm going to percuss to see if I can possibly hear if she has fluid on board. What I'm listening for is a dull sound, which would tell me that there's fluid condensation in her lungs. And I do hear some fluid from her mid to lower base bilaterally on each side. I'm going to auscultate her lung fields now using the diaphragm of my stethoscope. There are 3 lobes on the right side of the lung and 2 lobes on the left side of the lung. I will start at the apices of each side and I will go down distally under the scapula on each side bilaterally, listening from one side to the other for any type of difference in the sound. When I ask you to, will you take a deep breath in through your mouth and out through your mouth? Deep breath. Okay. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And one more time, deep breath. What I hear on the posterior side of her lung field from her mid to lower base is coarse crackles all the way down. I'm going to listen to her anteriorly and see if I hear the same crackles. Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. I do hear crackles both anterior and posteriorly. What I'm thinking is that because of your cardiomyopathy, you might have some congestive heart failure and some fluid buildup in your lungs and also in your lower extremities. I'm going to call the doctor and see if I can't get an order for a chest x-ray to evaluate for pleural edema, and also ask if we can do some IV Lasix to help you diurese some of the fluid. And what that means is The fluid will be taken from your lungs and your lower extremities, and you will urinate more frequently. And then over the next 24 hours, you should see a marked improvement. I'm noticing that your oxygen level's dropping a little, so I'm just going to switch you over to this mask, which will help you breathe a little better and keep your oxygen level up. Once we get the Lasix and some of the fluid off your lungs, hopefully we can take the mask off and go back to just the nasal cannula. Do you have any questions for me at this time?
Am I going to have any other tests? Is that it?
Right now we'll have the chest x-ray. Probably tomorrow we'll do the echocardiogram to evaluate your heart function and see if, how effectively your heart is beating. Do you have any other questions at this time?
No.
Well, thank you for being my patient, and that concludes my assessment of the congestive heart failure patient.